And good afternoon, morning, evening. Globally, a shout out of hello from the Association of PEMF Professionals. I am Dr. Jerry Dreessen. I am the executive director here at the Association of PEMF Professionals, where our goal is to unite, educate, and grow everything that there is to know about PEMF. And if you have been following us the last couple of weeks, we are at part 3 of our 3-part series on what's trending according to PEMF and artificial intelligence. So we jumped in, we asked chat as far as what's going on, and AI answered. So in essence, it has pulled the information from the internet based on what its researching has been able to provide. And so what we've done is that we have finishing up the last of our series here, and quickly with what's going on, that pulsed electromagnetic field therapy is seeing a surge in interest. With recent developments highlighting its potential across various medical applications. And here are the key trends based on the current web data. Those of you that saw part 1, you saw that we're talking about PEMF interest over time. So back in 2020, all the way up to current, you can see the rise of PEMF and its interest. People are searching the internet for PEMF and what's going on, not just for human side, but animal side as well. And those of you that have built a career on PEMF, you can see that you are in the right place at the right time, because this is only going to go up in trending. In fact, this is usually the base of what we call the hockey stick. So it goes right along and then boom, then it really kicks up. So we're getting close to the very corner of that hockey stick, in my opinion, with what's going on. We also talked about, where in the United States it's going on. We talked last week internationally as far as what's going on, what countries are really starting to trend on this too. But you can see that right now, as far as interest, we're seeing kind of in the upper middle part of the U.S., but also down in Florida, I think is a lot of it too. But again, we went from a point where, we went from, well, what is PEMF? I spent a lot of time putting together a 2-3 minute talk on, the elevator speech on what PEMF is and what it can do, all the way to, oh, you've got PEMF, can I use it? So just in the last 5 years, just even that whole aspect has changed dramatically. So the other thing that I want to do is go through the last part of the trending research that's popping up. And the one that we have a hard time talking about because it's not been proven, so we can't say PEMF cures cancer. But what we can do is talk about the research and cancer. And so cancer research advancements, and again, AI pulled this up, but there is emerging research suggesting that PEMF may have anti-cancer effects. The study on bladder cancer shows slows the proliferation of cells. We're also seeing alteration of gene expression, and then also triggering cell death or senescence in cancer cells. So again, there has to be, if you're going to claim anything with the word cancer, there's got to be a ton of studies that continually prove what's going on. But that's also what we're seeing. We haven't seen anything in the research that says, yeah, didn't do anything. So that's the great thing about this. And we do know that it does help increase the body's anti-cancer properties. So now we're just kind of linking the positives together for the conclusion. Not seeing a direct line of events showing that, which is why we can't say that it does. But those of you that are using it to help with areas that have cancer, you know that you're seeing a decrease in that person or that animal. We're seeing tumors shrink. Lots of great things. But again, it's not quantified. We're not doing a double-blind study on this. And so it can be difficult to say that it can until it gets past the eyes of the research people. Now, the other thing that we've got is cardiac and neurological applications. So PEMF is being explored for heart and nerve repair. It's also shown promise in reducing scar size and improving cardiac function, post-myocardial infarctions, at least in mice and pigs. And those are the two animals that are close to humans as far as when there are studies that are done very similar in how our bodies and our cells respond to these things. And additionally, magnetic field therapy is considered as a promising strategy for spinal cord injury treatment. So we are, again, like I said, we're on the cusp of some major things going on. And once this has started to be used commercially and the word gets out, you guys have been positioned in the right position, right? You have been positioned in the right field for what's going to be taking off. Bone and tissue repair, we can show that. We can show a before and after x-ray and show that bone repair is dramatically improved. In fact, it's been FDA approved for fracture healing. I've used it, have the exact same results, speeding up fracture repair. And there are, it's being used in hospitals. And the great thing about PEMF is it can be used over the cast. Another thing, it doesn't have to be attached to the skin. For electrical modality, you can put it right on top of the cast and it's going to penetrate the cast and go in and work its awesome properties. And then, of course, mental health and depression. Recent studies are investigating PEMF for treatment-resistant depression and electromagnetic stimulation showing potential as a novel therapy. Again, we're bringing in better blood flow. The brain's working better. Those of you that are using it, there are doctors out there that are, PTSD docs that are using this and getting great results. Especially, the spouses are noticing the difference, getting better blood flow, getting the brain activity, working in these areas. And there's been some pretty cool cell microscopic visualization of cells of brain from the brain changing as a result of PEMF, but also helping in the areas where there's all these, it has to do with mood and habits and things like that, where we can break habits, all of those things. And again, it all starts with using the systems in a proven way. And again, those are the things that we teach inside our membership area. Safety and non-invasiveness. And again, that's the great thing about PEMF. They're noted for being safe, non-invasive with minimal side effects, boosting their appeal for both clinical and home use. Side effects include like dehydration, people that they detox, so they feel a little nauseous afterwards. So again, make sure you drink water before and after. The other thing that happens is any medication that you're taking, PEMF helps the body absorb the medication better. So oftentimes people that are on a major medication often start showing the symptoms of the reaction of the adverse side effects of a medication because their body's absorbing it too much. And so those are things that we ask you to work with, the client, and also if they're on medication, to make sure that they are taking a safe dosage. Because imagine, taking a dosage and the body's only absorbing 50%. You use PEMF, now it's absorbing 75%. So there's going to be, a little bit of toxicity. So those are things to consider. But the trends reflect a broadening scope for PEMF, from traditional uses in pain and bone health to cutting edge applications in oncology and neurology. And always, of course, consult healthcare professionals before pursuing PEMF therapy for these things that we just talked about. Those of you that are certified, gone through the training, you know what we're talking about. Just safe practices. So those of you that have PEMF machines and you want to try it out on a neighbor or a friend or a pet, just know about what you're doing and what can happen when you're using it. And the worst thing that can happen, in my opinion, is that they feel better. But of course, they can have that toxic reaction as their body detoxes and they feel a little nauseous. So um, I can't imagine anybody ever having a problem with PEMF if it's used correctly, I guess is what I'm trying to say. So best practices, know what's going on. And again, that kind of wraps up our 3-part series here on what AI is finding out. And you can go to ChatGPT, you can go to Grok, and you can say, what do you know about PEMF and burns? Or what do you know about, fractures in animals, or, improvement of health? And all AI is really doing is it's going out to the web and it's finding articles that are already published, things that are already being talked about. It's even going into the ALPP, where ALPP's information is being quoted now. So you're getting pulls from all over the place to create these answers for you. So use it for a quick answer. Of course, those of you that are members here, the ALPP, you can go into our database and do that. You can always ask us questions as well. If you're watching this for the first time, as I've mentioned, the things that you can do, you can learn more about us. If you're currently a member, help us reach more by liking and sharing the video that you're seeing today, and go out to our blog and you can read about these things. We've got Instagram, LinkedIn, YouTube. Pop on out to those areas as well. Some of you are actually watching a live broadcast right now on YouTube, so versus the Facebook page. So there's lots of really cool ways of helping spread the word. Those of you that are members, if you got some things you want to talk about more in private versus public, you've got our members area to do a chat in there. And you can also do some things that you're working on. You can throw it in there, so you're like, using other members to kind of bounce ideas off of and to get their answers as well. It's a great way of a great community of going in and talking. And again, those of you that are wondering who we are, this is our code of ethics. So this is who we are and what we're all about. And if you have any questions, info@PEMFprofessionals.com. If you want to become a member, PEMFprofessionals.com for becoming a member. There are different types of certifications. There are different courses that we have available. If you are a business and you want your crew to get certified, we have packages available for that too. If you're a manufacturer and you want us to be the certification company or organization for your company as well, for people that purchase your products, give us a call. We've done that with a few companies already, and we're more than happy to allow that to happen to make your job even easier. And with that, again, thank you. Those of you that have been watching us here and again, commenting in the comment section and post comments. We're having a great time. Like I said, this is a very exciting field to be in. It's something that I've been part of for many years. And being part of this process. And that's why we're doing it, is to help you out and become better practitioners as well. So with that, thank you so much for your time today. And I look forward to meeting you next week, where we start either a new series or we start working on some of your questions that you have as well. So again, take care. Have a great week. We'll see you.